contact during lateral gliding. So those information are very important, because if we will look at the WHO report from 2011 year, for the question, how many natural teeth do you have? In Europe, only 41% said that they have all the natural teeth. How many of your natural teeth do you have? It was like all said 41%, 20 or more, 32%, 10 to 19, 12%. It means that actually almost 60% of the population, they already have the unilateral pattern of chewing. And if there is a unilateral pattern of chewing, we know that in the answer of our organism, the answer of the stomatognatic system it's the adaptation. And the adaptations norm, which changes to dental occlusion forms, they can concern periodontal ligaments, orientation and turnover rate, cementum resorption, mineral composition, alveolar bone, and TMG remodeling. So we know those things from our patients, how the occlusion planes can actually change. One of the adaptation is alveolar bone and condyle changes. This is also the article about the changes associated with the TMG and the dentition status. We have changes in the look of the condyle heads and even the condyle length. And we have also the changes in the mandibular fossa depth. So it means that if we have a case of missing one side of teeth in mandible or in the maxilla, if you want it or not, because this is the graph for the dental, partial dent, and completely without dent cases, if we want it or not, the depth of the fossa is altering during our life. So we cannot do anything about it. The changes of the articulation eminence morphology can also change, can also occur, as well the symmetry of the alveolar ridge, maxillary ridge can be present. So what kind of tools we can make to make our life easier and find those changes? Those devices are the Gothic arch tracer, the FMP angle device, and papillometer in order to gain better aesthetics. So the Gothic arch tracer can be mounted both in the case of full denture patients, as well in the case of lack of teeth. It's the best when it's mounted in the space between the first molar and the premolars, and exactly in the center of the mandibular gravity. Then we can, if the mandible is actually supported only in one point in the center of the gravity, when we will take the bite, we can find the real relationships between the maxillary and the mandible. With the use of papillometer, we can improve our aesthetics. This is the simple device from Candulo. We are taking two measurements. The first measurement is when the upper lip is in the rest. The second one, it's when it's tension, it's smile, or we are asking patients to simply tense the upper lip. And also we can use the AFP angle device. On the market, there's only one device. It's called K7 physiographic device, and it can actually show you the angulation between the maxillary and the mandibular teeth. So the main theme is the balanced occlusion prosthetic concept, because when we are restoring, rehabilitating our patients, the main goal of our treatment is to create the balanced occlusion. There are many concepts of occlusion, like Gissi concept, like Sears concept, French concept, pleasure concept. They are describing very nicely how to use the teeth, but they mainly depending on the slopes, on the cusps, on the inclinations, and on the guidance. And we want